Good morning. We're here, privileged to be here in Cosmetic Dermatology Country Club with one of our wonderful providers here at Wake Forest Baptist Health with cosmetic services, Dr. Amy McMichael. She is the chair of the Department of Dermatology. Thank you for being with us today, Dr. McMichael.
It's my pleasure.
Awesome. Great to have you. So one of the things we want to talk about just to kind of start off at a high level is we've kind of created this, this group of cosmetic services departments here at Wake Forest Baptist Health. Tell us a little bit about the whole group and how they come together and complement each other.
Great question. So, this group comprises about 5 or 6 different areas in the hospital that have really been working together for years. I would say I've been here for 25 years. I've been working together with all of these people for 25 years. But what now comes together is that we actually have a focus on our cosmetic patients. So whether it's plastic surgery or the need for interventional radiology for vein treatment or ENT facial plastics, we all work together to really get all of our resources so that if we're doing something that's specialized in our area that no one else offers, but you know what, there's something else maybe you can do, but my colleague over in plastic surgery is going to be the one to do that, we can do that more easily. We have an open line of communication, we understand what each other does, and it's all resourced, and even while it's not offered under one roof, it feels like it is because it's so smooth and there's really no problem getting people all the different places that they need to go.
Absolutely, and one of the benefits of having this great health system and this great world that you're talking about with these fellowship trained, board certified providers that really have all this expertise to provide a thorough treatment plan across multiple services.
Doing tried and true, wonderful, but cutting edge work.
Yes, that's awesome. So talk to me, obviously you're the chair of dermatology, but then we're talking about cosmetic services and we're here at Country Club at Cosmetic Dermatology. So let's talk to our viewers a little bit about the difference between cosmetic dermatology and dermatology in and of itself.
So dermatology is the study of skin, hair, and nails. That's from the top of your head down to the bottom of your toes, bottom of your feet, everything. Whether it's a rash, it's a skin cancer, or anything else that you can imagine, we take care of it. We even get inside the mouth, the lips, vaginal areas, the genital areas, the whole thing. But when we're talking about cosmetic dermatology, we're focusing on those cosmetic needs of the patient. They may be on the face, neck, chest. It may be other places. So, we take care of hair removal. We do cryoablation of fat, so cool sculpting. We do a lot of stuff on the face. So when you need those cosmetic things, then that's a special service that we try to separate out for you and really focus on your needs.
That's awesome. And one of the benefits we have here at Wake Forest Baptist Health, and I think not maybe clear to our viewers and the public in general, is this ability we have to do very, very complex cases, but also to do some simple, sounds like the wrong term, but some of these basic procedures that people need that can help improve their, make them their best use. So I think that's a cool piece of this.
Yeah, it is. What we like to say is that we really know all the data. I mean, many of us have written all the articles about what we're doing, and so we know the data. It's not just somebody who's out there who may be somewhat trained, maybe not. We're all very well trained, and we've all done this for a while. There's no one who comes out without the appropriate training. When you're coming here, you're getting the best.
That's awesome. Yeah. That's awesome. Well said. So I do think it's interesting when you talk about the whole body and all the different areas that you treat for dermatology, because I think it is a habit or a natural thing for people to think dermatology and think at least chest up, if not neck up, right?
That's right.
However, in contrast to that, I know a lot of people do talk about the face and what we can do to help the face and create that better look and more confidence and all that kind of stuff. So as we look at, one of the things people think a lot about is Botox. So I know we deal with Botox and fillers, and talk to us about the difference between the two and what the benefits and advantages are to some of those treatments for our viewers here.
Absolutely. So Botox is really a muscle relaxant. We use it in lots of ways for that, even medical ways. But when we're using it for cosmetic things, we're really trying to relax those furrowed muscles, the forehead lines, the frown lines, maybe lines around the eyes. You can use Botox in the lower face. Patients come in and they tell me, I'm looking draggy, I'm saggy, I want some Botox here. What they're really talking about in that case is filler. Okay, so what we know and what we can explain to you and educate our patients about is what goes where and how it's going to make you look better and how it's going to make you present yourself better and how it's going to make you feel better. Because we actually know, and we have data that shows if you are more comfortable with the way you appear, you feel better. You actually are less depressed. I mean,
Absolutely.
there is absolute data to show that. So Botox is more of a muscle relaxant, taking out those really kind of furrowed lines. And then the filler is something that lifts and volumizes. And so we want to take that gravity part away and lift and mush and fill, and that's what filler does. And they work very well together to sort of rejuvenate and make you your best self. And we use them in very interesting ways when we're as trained as we are. It's not sort of your basic Botox or your basic filler. We really do the cutting edge techniques that are new. I mean, it's very, very new how we use things, and a lot of people don't realize how we do it, and it's educational to just come in and get it.
Well, and I'm glad we're getting to tell them today.
Yeah,
so that's great.
Absolutely.
So you talked a little bit about cutting edge. So let's transition to kind of a trending topic, something that we're hearing more and more about here recently. This notion of platelet-rich plasma treatments, or PRP, right?
Mm-hmm.
So it's a trending conversation. I know we have a couple of uses that we want to talk about today that we're using that treatment for here at Wake Forest Baptist Health. So let's first talk about microneedling in our world of cosmetic dermatology, and how we can use PRP in partnership with microneedling to help make a better result for the patient.
Yes, so microneedling is a service where we use a very small sort of electrical tool that goes across the face. It's almost like a poor man's laser, if you will. It helps with fine lines, it helps with complexion, dark spots, some wrinkling, not the active wrinkling, but the sort of just wrinkling that's sort of sitting there at rest. And it makes these little tiny channels across the face that then heal, and as the healing occurs, it tightens the skin. So by itself is a great treatment. When you add PRP to it, or platelet-rich plasma, it takes it to the next level. So what is PRP? Well, that's where we draw your blood, we spin it down, and we take the top layer of plasma, which has the activated platelets in it with lots of growth factors and all kinds of good things, and we actually rub it on top of the skin. So it goes right into those channels and gives you that next level clearing of your skin and just overall a wonderful outcome. And so we have our wonderful cosmetic nurse, Tina, who does this for us, and she's ready right now. You can call her today. She'll get you in. She does it. She does a beautiful result. She has befores and afters that are unbelievable. So it's a really nice service that we offer.
That's awesome. Well, and I think it's interesting, like you say, you're using your own blood. So as opposed to using, we talk so much about chemicals and what's being used in all these products that we have in our society today.
Yes.
Here we're using, it's very natural. It's
natural.
very unique to you and your own DNA, if you will.
Correct. It's natural. There's nothing outside used. It's all you.
That's awesome. So one of the other things that I think some people, luckily I haven't, knock on wood, had to deal with it yet in my life, made at some point, but is hair loss. And I think, as I understand it, PRP can help with hair loss as well, whether it's hereditary hair loss or something more disease or medical concern related, right?
Absolutely. So PRP has been used, around the world for years in lots of different ways. So it's been used in orthopedics. It's very well accepted in joint procedures, that sort of thing. So we're not taking something that we just sort of thought up and decided to use for growth, But what we found in the last decade is that it can really help with hair loss, especially female male pattern hair loss. Now we're also experimenting, and I shouldn't say experimenting, we also have lots of data that now suggests that it works in other forms of hair loss as well.
Okay.
So when you come in, it's not just for those, and we can help you decide whether or not it works for what you have. But what we're finding is if we do PRP treatments, and usually you need about 3 to tell you if it's going to work or not. We inject it directly into the scalp, the affected areas, that after about 3 treatments we can see really amazing outcomes. And it is just awesome. It's a little bit tender, more tender than just rubbing it on top, but we like to really get it to where the hair is growing, so we put it in as an injection.
Well, and you talked earlier about kind of us letting us help you find your best you, and making you feel better overall, not just about yourself, but better on a day-to-day. We got enough things to worry about in today's society.
Absolutely.
We got, to be able to have that confidence in your reflection, whether it's hair loss or some of these other complexion things, is a pretty impressive technology.
Absolutely. I think it's, really about quality of life. We're all living, we're all doing the best we can. But this helps to just really improve your quality of life. And if you feel great about yourself, then you are very much more active in your life. You're going to be better for the people in your life. You're going to feel better at work. You're going to feel better just doing what you normally would do. And so that's what we want to help you with.
I think that's awesome. And as we've talked about, I mean, that's one of the benefits of coming to an organization like Wake Forest Baptist Health with our research backing, our innovations, everything that we're trying to do on the cutting edge of technology and research to create the best treatments and the most sophisticated treatments for the patient's needs. And that's really a benefit as opposed to some other locations that don't have those kind of resources.
Absolutely. I think that is well said. It's exactly what we do. We love working together. All of us, in this sort of consortium of cosmetic people, we swap patients out. We discuss, kind of tough cases. We, sort of set up ways to help patients to get to really, like you said, the best them. We want to help make the best you. And we know how to do that here. That's
awesome. Well, listen, we really appreciate you being with us. We want to thank Dr. McMichael. Thank you so much for being with us this morning.
My pleasure.
It was awesome. And if you want to learn more about cosmetic dermatology and the other services we offer within our Wake Forest Baptist Health Cosmetic Services world, you can go to wakehealth.edu/cosmetic, or you can give us a call at 833-YOUR-BEST-YOU. That's URBESTU, and that number is 833-872-3788. Thank you so much for being with us this morning. Have a wonderful day.